Patients are making up 15.83% of the patient capacity for hospitals in our region. That according to the Texas Department of State Health Services. Tonight, Trauma Service Area B, which includes Lubbock, only has 19 available intensive care beds and 191 available ventilators.
With the cases on the rise here and in our region, we bring in our medical expert, Dr. Samir Islam now.
Dr. Islam always gives us the straight info here and tells us what it means for all of us. We're always glad to have him with us. So, Doc, explain to me why 15% is a number we've been told to watch for and what that means for hospitals and those who need care of any type, I guess.
Absolutely. So Governor Abbott had an executive order in which he told us that if there were a number of consecutive days in which the hospitals were at 15%, that would be the time when he would consider shutting down the bars, restaurants, closing down some gatherings, and also cutting back on some of the elective procedures that we do currently in the hospitals.
So talk a little bit about that specific number of consecutive days of this 15% capacity. Does that mean we'll see some changes going on if we meet that number?
Absolutely. And so usually what we heard is that for 15% for 7 consecutive days, that is going to be the time when we start cutting back on some of the elective procedures. So maybe your gallbladder surgery, your knee surgery, or maybe even other things that you put off towards the end of the year, that may be shut down or cut down because of the number of COVID cases that are there and with the hospitals being so full.
Doc, I know hospitals rely on these elective surgeries a lot as well as part of their money-making process, which is part of any business out there. But if I have an elective surgery scheduled now, should I think about putting that off? What should we do here?
That's a very good question. It's a hard question to know because we don't know exactly if we're going to have to cut back on those elective surgeries. My recommendation is, number one, if you have something planned, go ahead and plan for that because we don't know if there's going to be a cut down in cases or whether we're going to continue what we're doing right now. But if you are concerned, the best thing would be to speak to your doctor who's performing that particular surgery to get their thoughts, to see how urgent it is, how emergent it may be, or whether it can be put off for maybe a couple more months.
Let us know too, are you concerned with the increase that we've seen of the coronavirus numbers here in Lubbock County?
Absolutely. I think there's two main things that we're worried about. Number one is that there are so many cases that are there that more healthcare providers are getting sick. We have nurses, doctors, other people in the medical field who are getting sick with COVID-19 or having to be quarantined, which limits our workforce. But not only that, when you have more and more people in the hospital, that means that routine medical care, if you have pneumonia, you get into a car wreck, we may not be able to take care of those patients in the current Lubbock facilities, and you may have to be placed somewhere else to get the routine medical care that we typically get here in Lubbock.
And Doc, you know, all of us who are out and about, I've heard this called COVID fatigue. We're trying to do what we're supposed to do, but maybe I forget a mask once in a while, and yeah, you know, who cares? The odds are different. What kind of danger is something like that really?
I completely understand. We have been dealing with this since March, and it is very, very hard. I will tell you this. We are seeing more and more cases now than we ever saw. But not only that, we're entering flu season as well. So that occasional time when you forget to maybe wash your hands or to wear your mask, that may be the one time that the virus needs to infect you, or maybe more importantly, affect those that you love who may not have the immune system or the capacity to fight off that virus.
Okay, so don't forget the mask. Always do what we've been told to do for a long time. Dr. Islam, thank you so much. We appreciate your time.
Thank you for your time.
And